Welcome to Abra Code Dabra. Now I know you may think by the title that we're going to have a magic show today, but I'm sorry, no, we're going to be learning about cross-coding today. We're going to learn all about cross-coding. We're going to learn how to implement cross-coding in your practice. That's a big step. And I first would like to find out who's in my audience. How many dentists are here? Fantastic. I love it when the dentists come to the cross-coding classes because the dentists are the ones with the best clinical knowledge that will understand the diagnosis codes. And we're going to learn lots about diagnosis codes today. But it's very significant that the dentists understand that part of cross-coding. The business office, how many business office people do we have? Fantastic. Usually that's the majority of who's here, and your role will be extremely significant and more so than any other of the staff members. But you'll benefit tremendously today from this course in learning how to fully implement this, understand how to complete the claim forms, and just really get your practice going with this. Now, how about hygienists? How many hygienists? Fantastic. Now, the hygienists play another significant role because hygienists tend to be the ones that spend more time with the patients than really any other team member. And it's you that will be asking the questions, reading the health history forms. You'll be the ones that will potentially be choosing patients that are medically compromised and that we can submit these claim forms on. And dental assistants too. Your role too is ask questions, and really everybody's role is going to be communication. To really fully implement dental medical cross-coding, there's got to be good, strong communication in the office. So when you go back to your practices, probably Monday morning, you need to get started with this process, but you need to really plan a meeting and get everybody together, figure out what everybody's role will be in this. But we're going to learn today about the roles, but lots more. Now, how many of you are familiar with the easy button that Staples puts out? Yeah, you press the button, it says, that was easy. Well, that's the way it was. It was easy. But now it is becoming more and more difficult. The research into the systemic link has created a situation in the dental practices where now dental carriers are sending letters in response to the dental claim saying, you have to file with medical first. And if you don't know how to do that, how do you get any benefits at all for your patient? So it's really an important system that we need to implement in the dental practices. Now, you may have heard some horror stories, so I want to dispel the myth. It is not impossible to do. It is not impossible to get those benefits. You just need to know how to do it. So what you may have been hearing that are negatives about, oh, it's just not even worth doing this, it's too hard to do. If you understand the process, it makes it so much easier. What you've been hearing is possibly from people who didn't really get trained and just tried to create these claim forms on their own without the background to do it correctly. So please don't let that overshadow you. Let that become something to forget, and you're going to learn today how to do it. It will make it so much better for you. Now, why do we even want to do it? That's probably your number one question. And yeah, I already mentioned one of the reasons why is because the dental insurance carriers quite often now are, especially for third molar extractions and certain surgical procedures, they're sending these letters that says that you have to file with medical first. So in that sense, yes, we have to do it. If we don't do it, as I said, there'll be no benefits at all. But we're also going to be helping our patients, especially with the higher priced medically necessary procedures that we might be doing. You know those dental maximums are about this big, and medical does not, in most cases, have an annual maximum to deal with. So we've got lots more benefits to work with for our patients, and so that's very helpful. But if we can find out for our patients, if medical can help pay for these procedures, don't you know they're probably going to be much more likely to accept the treatment plan. And with more case acceptance, the bottom line, it increases the bottom line for the practice. So it's really a major win-win situation for the dental practice. So the things that we're going to cover today are the benefits. We're going to have an overview of medical insurance. I want you to understand all about the different levels to the medical plan and the different types of plans that you can, excuse me, that you can be working with. And then we're going to learn how to implement the plan. We're going to learn about the different code sets, and we're going to learn how to fill out that claim form because it's quite different from the form that we use for dental. So yes, we talked about how if we are successful with obtaining benefits for the patient, the treatment plans will be accepted better, the bottom line will increase, so it definitely helps, but it also becomes a marketing tool for your practice. So if you are able to help a patient, and that patient is getting a good benefit from the medical plan, they're going to become your #1 champion. And they're going to be telling their friends and family members what a great practice you have. So it's really these are really good, strong reasons to implement this in your practice. Of course, you're going to want to know, well, now, if we've just talked about why we would want to do this, well, what can we submit to medical? Well, there's quite a number of different procedures. The bottom line is they have to be medically necessary, and we'll talk about that in just a minute. But what we have to remember are that there are a whole list of different things we can send in, but we get kind of caught up with thinking about specific procedures. But I want you to remember that almost always there's an exam. Quite often there are radiographs, diagnostic tools, all of those things that are done for that medically necessary procedure, those should be sent in too. So don't just single out the procedure itself. And of course, you know that many, many oral surgical procedures can be sent in at this time. But biopsies, if you're in your practice, if you do biopsies, they can be sent in. Anything that goes to, that's pathologically related, that goes to a lab, we can send those in. Trauma, any reconstruction due to trauma, those are very strong medical claims. So we'll need to learn. There's special codes that you'll have to use for those trauma claims. Not difficult to learn, but you just need to make sure that you use those codes, but it will really significantly help your patients with that. And genetics plays a role too. If there's an oral problem due to genetics, then yes, those claims should be sent in too. TMD has been very successful for a long time now. Matter of fact, I had TMD problems way back in the 90s. I went to a dentist who helped me quite a bit with TMD, and we submitted all of my claims to medical, and it paid. It was wonderful. So I truly do appreciate how beneficial this can be. It helped me afford the treatment, and so that's significant. And then, of course, anything pain-related, myofascial pain conditions, those things can be sent in. And sleep apnea appliances, that is just taking off now. Even Medicare now is covering sleep apnea appliances. My husband has sleep apnea, and he wears a CPAP, which it's a big plastic piece on his face, hoses that come to it, a machine over here that he can't just jump out of the bed and get out of bed fast because that thing will go on the floor. He does quite well with it, but a lot of patients are not tolerant to that machine. And sleep apnea is a morbid disease. Dentists are helping patients, and you'd be amazed how many of your patients suffer from sleep apnea. So there again, the hygienist, the dentist, ask questions about, do you snore? Have you ever had the sleep study done? And take it from there. We can really help our patients a lot. But anyway, getting back to, yes, sleep apnea is definitely a very successfully filed medical claim from dental practices. Now, let's look at the different types of medical insurance plans that you'll be working with, because you're going to want to understand when a patient comes in and hands you that card, you need to know what it is you need to be doing, because not all of the plans have the same requirements. So there are indemnity, there's capitated plans, there's PPOs, there's Medicare, there's point of service plans. Maybe not lots and lots of different plans, but a good number of plans, so you need to understand what to do. Now, indemnity, that is probably the oldest plan that there is out there. Very easy to work with. The only thing that you'll probably notice is that some people will have group plans and some people will have individual plans. And you'll find that the individual plans tend to have very high deductibles in many cases, and also maybe lower benefits than the group plans. But one thing I want you to remember is that sometimes if, say, you're treating a spouse or a dependent child, the parent will say, well, yes, this child is on this plan. And I say always call and make sure, because I have seen in my own practice how many times parents have said that, and then it turns out the child is not covered. So you just want to make sure that you don't want to go through all the work of completing that claim form and then find out afterwards that the child was not even covered or the spouse was not even covered. But anyway, indemnity is probably the easiest of all of the plans to file with. Now, PPOs, or preferred provider organization type plans, those are really very common, and probably a good number of you have a PPO plan for yourselves. Keep in mind that PPOs are networked type plans, but the subscribers do not have to stay within that network. You are free to go from provider to provider, but the consequence of going to a provider that's not in the network is that the benefits will probably be less. So they'll pay at a lower percentage in most cases. And most likely, because you're a dental practice